Let us know when registering for upcoming events. Next slide. We are happy that we're joined today by Vicki Shabo. Vicki is with Better Life New America. She's a senior fellow for gender equity, paid leave, and care policy and strategy at New America's Better Life Lab, and is also a subject matter expert advising New America's New Practice Lab. She is a policy strategist and coalition builder who has helped to win paid leave, paid sick time, equal pay, and pregnancy fairness policies affecting tens of millions of people. For nearly 15 years, she has been at the forefront of the fight to pass a national paid family and medical leave program and a national paid sick days law, playing a critical role in shaping policy, strategy, and nonprofit and business engagement in these policy efforts. She's also worked with advocates and policymakers in most of the states that have passed paid leave programs. And we will drop the rest of Vicki's bio in the chat in a few moments. We also would like to introduce Jared May. Next slide. Jared served as vice president at A Better Balance, where he works alongside advocates and coalitions around the country to write, pass, and implement laws guaranteeing paid sick time and paid family and medical leave. With his colleagues at ABB, Jared has helped to draft laws that provide paid sick time to more than 60 million people. He has championed the adoption and implementation of paid family and medical leave programs in 13 states and DC, including the groundbreaking passage of Colorado's FAMLI ballot initiative in 2020. So again, we will drop the rest of the bios in the chat, but we would like to turn things over to Vicki Shabo, who will start us off with this Paid Family Medical Leave 101 program. Thank you, Vicki.
Thank you so much. Thanks, Danielle, and thank you to NCIT and to the Heart Association. Hello, my name is Vicki Shabo. I use she, her pronouns. I've been working on paid family and medical leave for about the past 15 years, which is exciting. It's been exciting to see the progress, and it's been wonderful to work in coalition with Jared and A Better Balance and so many other folks, I think some of whom are probably on this call. So I'm going to quickly go through sort of what is paid leave very generally, why is it important, and where have we been federally with this policy. Before I dig in, I just want to acknowledge that I know it's been a really, really tough day for folks who work on a whole range of social services issues, and feel very much in solidarity with folks that are trying to figure out today how to get people the housing and the food support and the healthcare that they need. So paid leave is an issue and a policy that helps to support families as these other policies do, obviously further behind where we've made federal progress than on these other issues, but they all kind of are of a piece, and we all need to be fighting for getting people what they need. So with that, on to the next slide. So just to define some key terms, when we're talking about paid family and medical leave, we're talking about weeks or months to heal, recover, get treatment, provide or receive care. There's multiple components to paid family and medical leave. It's parental leave, so for any parent through birth or adoption or foster care, specifically also maternity leave for somebody who has given birth to prepare for recover from birth, as well as to care for a child. It's caregiving leave, which means caring for a family member or a loved one of any age through a serious health issue. It's also medical leave for a worker's own serious health issue that requires time away from work. And in some cases, it's also about military deployment and exigency leave when somebody has a military family member and needs to take time to be with them. It's also about safe leave for survivors of domestic violence and sexual assault and stalking. Often the popular culture thinks about paid leave as just moms and babies. And so that's why I feel like it's very important to define all of these terms. And for an organization or a collaborative like the National Coalition of Infants and Toddlers, we might think about parental leave or maternity leave being the most important piece to this. But actually, that piece is only about 25% of uses under the Family and Medical Leave Act, which I'll talk about in a second. And most of all, when we think about family economic security and the well-being of children and economically secure and healthy households for young children, we also need to think about the way that the adults in that household are able to care for other people, whether a spouse or an aging parent or some other family member. And it's important to know that in about half of cases where somebody is taking a leave to care for a family member or themselves, there's also a child under 18 in the house. So that is why comprehensive paid leave is so important. And just really quickly to define the other term that's here, FMLA, this is a federal law that was passed in 1993. You'll see that again on a timeline that I have. It provides protections to people who are eligible to take time away from work, again, for parental leave, for maternity leave, for caregiving leave, and for medical leave, as well as for service member leave. But it only applies to about 56% of the workforce because of eligibility and job tenure requirements. Specifically, for a worker to be eligible, they need to work at a work site that has 50 or more employees within a 75-mile radius. They need to have worked for their employer for at least a year, and they need to have worked 1,250 hours in the past year. So that leaves close to half the workforce out. And it means that some of the people who most need to be able to take leave can't afford it. And so unpaid leave only gets you so far. And then that other portion of people are risking their job to be able to take leave. So that's sort of defining the terms. What is paid family and medical leave and what is FMLA? We can go to the next slide. So why are we talking about public policy in this space? Just to put some numbers on things, only about 27% of workers in the US workforce have paid family leave at their jobs. And the lowest wage workers, folks who are making $14 an hour or less, are 10 times less likely to have paid leave than the highest earners, people who are making just over $55 an hour. And as you can see from this trend line, we've seen growth in access to paid family leave through employer policies over the last decade plus, over the last 13 years. But you can see that access has increased much more dramatically for folks in the top, even the median wage brackets, and not so much and hardly at all for folks that are earning lower pay. And of course, when folks are earning lower pay, they're less likely to be able to afford a leave, especially a leave without pay. Only about 4 in 10 workers have a short-term disability insurance policy through an employer, which gives them extended paid personal medical leave for a serious health issue. And on all of these things, as well as for unpaid leave, Black, Latin, Indigenous, some Asian American Pacific Islander workers, women, and workers with disabilities are most likely to be affected by the lack of paid leave, less likely to have access to paid leave, or FMLA because of the jobs they hold and the hours that they work. So we have a big gap, series of gaps to fill. The private sector hasn't done that. You can see that by this line chart, and that is why we need public policies. We can go to the next slide. One other thing I wanted to point out, because I know a lot of the states that are represented on this call have large rural populations. Often when we think about, or the media talks about paid leave, they think about big urban centers or sort of big cities. And here in New America, we did a report a couple of years ago focusing specifically on rural communities' access to and need for paid leave. We found that workers have lower rates of access to paid leave because their jobs tend to be lower quality jobs. They have greater health challenges in many cases, and demographic trends around aging and younger populations and how that shakes out in rural communities means that paid leave is a real economic and health imperative in rural communities. And yet, in addition, people in rural communities have to travel much further to get to hospital-based healthcare services. So we looked at 6 different types of healthcare services in hospitals, as well as skilled nursing care, and found that people in rural communities are 3 to 5 times as far from hospitals, from these services, as people in metropolitan areas. So as part of your advocacy and your education, this is data that we're happy to share. We have some state breakdowns, but mostly the national breakdown. And we can go to the next slide. So I think this is not a surprise. We're the only country in the world, the only high wealth country in the world that doesn't guarantee maternity leave to new moms. We are one of a handful without paid leave for new dads. We're one of 2 high wealth countries without personal sick or maternity leave. We had a bit of paid leave during the pandemic, specifically sick leave and childcare leave. That allowed people time away from work, but it expired. It wasn't renewed. This was like an opportunity that we should have been able to build on and weren't, and I'll talk about that in a bit also. And you can go to the next slide. So why does this matter? This isn't really just about fairness. It isn't just about what's right. This is about health and dollars and cents. Just some key stats here. I know these slides are really text heavy, and I apologize. And I think you'll get them afterwards. So, but just to keep in mind, 23% of women are back at work within 2 weeks of giving birth. This has infant and maternal health consequences and sort of implications for the ability to find stable, high quality childcare, and the ability for women to stay in the workforce and grow their economic security over time. Lack of guaranteed paid leave contributes to gender inequity in homes. Lack of paid leave to care for older family members leads to more than $300,000 in lost income and retirement savings. These are old numbers as well, so inflation adjusted is going to be higher. 22.5 billion lost annually in families' wages, which has implications for the economy, both directly and indirectly in terms of consumer demand. And the average family several years ago was calculated to lose $9,500. Again, adjusting for inflation, that's going to be a lot higher today. And this has implications for the labor force overall. COVID was obviously an extreme time, but it's estimated that 15% of workers left their jobs to provide care, 8% left because of a personal health issue. And the trends are headed in a direction that provides even more concern. 1 in 5 adults care for a child, an older adult, or both. And Gen X, millennials, and Gen Z, who are the bulk of the workforce now, increasingly have sandwich generation caregiving responsibilities, so caring for both a child and an adult. The flip side to this is the benefits. You can sort of deduce these. One thing I really want to point out, because I think it's quite important, is some new research from the Urban Institute that was done last year for the Department of Labor, finding a reduction in poverty rates for people that had access to paid leave, or projecting what a national paid leave program would look like, increased family resources, and the effects were particularly striking for families of color, for Black and Latino families. Reduced Medicaid costs, less TANF and SNAP use, and benefits for business. Often we think about benefits for people, but I really like to point out that this isn't just about workers and families. It's also about giving businesses the predictability, stability, and certainty that they need to be able to manage work when somebody is out. And that's why public policies are so important. There's also global macro policies, along with other interventions that support women's labor force participation. A national paid leave program is estimated to add 5 million women to the labor force and boost GDP by $775 million. Big numbers, reflecting that this one policy, along with others, could have a big impact on how we build a fair economy. So just really quickly, this fight is not new. We're really, I can speak for myself and I think for others, super excited to have so many new organizations that are getting into this fight. This fight's been going on for a really long time. So the FMLA, as I mentioned, passed in 1993. We're about to celebrate the 32nd anniversary next week. But as I said, it only provides unpaid leave. It has a limited definition of family, and it has these business size and job tenure carve-outs that leave 44% of the workforce behind. Less than a decade after the FMLA passed, we saw paid leave pass in California. It's been updated multiple times since then, including a pretty historic expansion a couple of years ago for job protection through through legislative changes. They early on updated family members, and they want to do more of that. But most important, they updated their wage replacement rates this past year. And I think Jared will probably get into why good wage replacement is so important. New Jersey also passed paid leave in the 2000s, the first decade of the 2000s. And that was the first time that we saw a federal paid leave bill introduced. And by the way, it was bipartisan. Chris Dodd, who's a former senator from Connecticut, Democrat, and Ted Stevens, who was a Republican from Alaska, who unfortunately died in a plane crash, had a proposal for a national paid leave plan. We saw Rhode Island pass a law in 2013, again, updated since then for the number of weeks that it provides. And then finally, we, after many years of working to define what a comprehensive national paid leave social insurance program would look like, saw the Family Act, the Family and Medical Insurance Leave Act, introduced in 2013. It was introduced at that time with a coalition of something like 350 organizations, close to 100 businesses. And we've been working, many of us have been working since then to keep building that drumbeat, learning from state examples, and working to improve that bill. And I'll talk more about that in a second. 2016 was the first time that we saw candidates on the presidential stage address paid leave and come out with proposals. I think important for this moment, when Trump was elected the first time, I think a lot of us were very concerned about whether conversation on this issue would keep going, and it did. We saw Trump budgets propose paid parental leave. We saw a paid leave tax credit enacted in 2017. I'm going to come back to that in a second because that's up for renewal this year. And there were some other proposals, not good proposals, proposals that would be quite harmful, but nonetheless addressed paid leave, showing that this is an issue that lawmakers on both sides of the aisle were paying attention to. In 2019, we won 12 weeks of paid parental leave for federal workers. There's still work to be done there to win caregiving leave for federal workers. Your call as to whether we think that's likely, but it's a bit of business that needs to be finished. We also saw during the Trump years a lot of momentum at the state level. So 2017 to 2020, we saw 7 jurisdictions pass. And then we got to the pandemic, and we can go to the next slide. So 2021 was this big moment where we had the emergency paid leave that I mentioned, or sorry, 2020, we had the emergency paid leave that I mentioned. And then in 2021, we had a big push to pass a comprehensive federal paid leave bill. You can see a summary of what that and the Family Act include on the right side here. Needless to say, we learned, there was a big, robust coalition that was built. I think something like 1,000 businesses and business leaders joined together through the sort of intermediary efforts of several organizations to ask Congress and the president to pass paid leave, and yet we weren't able to do it. Nominally because of one senator, I think it's probably deeper than that, but we learned a lot. We saw more states pass in 2022 and 2023, and I think I left some states off of here. I apologize for that. No, maybe not. Anyway, more states. We saw a new Family Act reintroduced in 2023 with learnings from the Build Back Better fight and advances in states. In 2023, we also saw a bipartisan working group meet for the first time, again, demonstrating at least an openness to learn more about the policy issues. We've seen proposals come out in the last month or two on 2 of the ideas there. We can probably talk more about that on a different webinar. And now we get to 2025. So what is to be done in 2025? Which is, I'm sure, the question a lot of folks are asking. The FMLA needs to be expanded, and there are 2 bills that currently are accepting sign-ons from organizations. For that, one of them would drop the tenure requirement so that people who have been on the job for just 90 days would be eligible for FMLA rather than needing to have been on the job for a whole year. And the family definition. Right now, the FMLA is just parents, spouses, and children, and largely minor children, except when a child is an adult that's incapable of self-care. So, and that would be expanded by our proposal that's out there. We can share more information about that for groups that are doing legislative advocacy work or want to learn more. The Family Act will be reintroduced probably close to Mother's Day. The bipartisan working group is looking for input on the two proposals that they put out. One is about public-private partnerships, and another is on states, the federal support for state administrators getting together to talk about ways to harmonize their programs. We are also going to see the tax fight. I'm guessing that most people on this call are watching the tax fight for any number of policies. The paid leave tax credit that is out there really hasn't had an impact, and happy to take more questions about that, but it has been very underutilized as far as we know from the data that's been published, and about 90% of the money has gone to very, very high revenue companies. Also on the horizon in 2025, state progress potential in places like that some of you are working in, probably Hawaii, New Mexico, Pennsylvania, Virginia, maybe Illinois, maybe some other places. So that's kind of where we are policy-wise right now. And just a couple other points I'd like to make, and we can just go to the next slide. So one of the things that often is asked is like, isn't this just a Democrats issue? No. In the legislature, this is sometimes an issue on which Democrats are supportive of comprehensive policies and Republicans are not. Among the public, support for a comprehensive paid leave program at the national level, one that is publicly funded, is hugely popular and has been for like a decade. 75 to 80% or more of voters or the public, depending on who is being sampled, tend to support paid leave in polling, and not just support paid leave, but support a program that support the description of a program that looks something like the Family Act or like the state programs. 90% of Democrats, usually 75 to 80% of Republicans, usually around 2/3. I'm sorry, 75% of independents, usually around 2/3 of Republicans. I have polling in my office literally going back to 2008, and this has always been true. So it's not like a new phenomenon, it's something that's been very stable. And when voters are asked about the pay for, they are supportive of tax fairness solutions. They're also supportive of small payroll contributions by employers and workers. And they're generally, when asked ranges of how much they're willing to pay, most are willing to pay more than a program would cost. Also supported by small businesses. You often see the media listen to a lot of business trade associations who are not who do not generally tend to like taxes or government regulation. But if you go talk to real small businesses and survey real small businesses, you find widespread support. 79% in the most recent polling by Small Business Majority and the National Partnership for Women and Families. Other polling shows that businesses in states with paid leave programs see positive impacts, and businesses in paid leave states who were asked specifically about their experiences with these programs have very positive things to say, even more so post-pandemic. And then we can go to the last slide. So this didn't work out very well. Anyway, this slide, when you get it, hopefully will look better, but tries to present sort of what good versus ineffective policies look like. Not all paid leave policies are created equal. A strong policy is one that's universal and mandatory, not something that's voluntary or incentive-based to enrich companies. It's open to everyone and has job protection. The job protection piece becomes really important. And just trying to think what else I need to run through here. It should apply to all working people, not just to women, and should be for all reasons, not just for parental leave. And sorry, let me just look at my own slide here to make sure I'm not missing anything, or I can come back to it later. But anyway, basically you want a policy that's as comprehensive and inclusive as possible, and not something that necessarily enriches an insurance company or a corporation. And then finally, we can go to the last slide, which is overall, everyone deserves time to care, recover, and heal, and be financially secure. This is a pro-family policy, a pro-business policy. It strengthens communities. And the work that you all are doing, whether that's policy development or research or coalition building or storytelling, or business organizing all makes a difference. And the last thing I'll say is I think we can tell that this fight is a long-term fight. I would say that it's important to keep an eye on the sort of the long-term goal and know that that building that you're doing towards what we know evidence tells us makes a good policy is more important than getting a short-term win that's going to set you back. Obviously, incremental progress, and Jared's going to talk about some good forms of incremental progress, is really important. But there's also ways in which you could undermine long-term goals. And I think part of why we're here is to help figure out how to help you navigate these waters and get you what you need to be able to make the most compelling case for strong, effective policy.
Thank you so much, Vicki, for that presentation. Again, we would like to remind everyone that the presentation slides will be sent to you within a week. And if you have any questions for Vicki, please save them, drop them in the chat. We will review questions right after Jared's presentation. And so now I would like to turn it over to Jared Nake.
Hey, everybody. Thanks so much for having me. It's great to present. As Vicki mentioned, we've worked together for many years. You can go to the next slide. So a little bit about a better balance. And I know I've worked with many of you on this call, and great to see some familiar names. But for those of you who haven't worked with a better balance, we're a national legal advocacy organization. We have offices in New York, Tennessee, Colorado, and Washington, D.C. I'm based in our Colorado office and have worked on the ground on our paid family and medical leave program. And you could see our mission, but essentially ensuring that workers can care for themselves and loved ones without sacrificing their economic security, and some of the issues we work on, including paid family and medical leave. And we'll mention too, especially those of you who have clients or members, depending on your organization, we have a free nationwide legal helpline and represent and advise workers on these issues around the country. You can see the 1-800 number at the top of the slide. So we can go to the next slide. So yeah, so wanted to walk through to build on Vicki's presentation on some of the key components and really best practices for paid family and medical leave law. And, these are, again, best practices. It's where really models start out, recognizing, of course, that a lot of states have had to compromise on some of the details through negotiations and, important strategy decisions. But as a starting place, as Vicki mentioned, really fighting for universal coverage is important for a social insurance program, having a bigger pool, but also just ensuring that the benefits of this program can really be realized. Universal coverage is important. And covering workers regardless of the size of their employers, as nearly all the state laws that are in effect, the 14 programs do. And in particular, just to reinforce that these programs have particular benefits for small employers who can't afford to pay weeks of leave out of pocket, and really do benefit in leveling the playing field with the larger companies that have a competitive advantage because they can afford to offer paid family leave. So really important to cover regardless of size. Best practice covering both public and private sector workers. Ensuring, and this is something that the paid family and medical leave model and programs, allow, and it's an important feature, but ensuring that self-employed workers, those in the gig economy who truly are independent contractors, can opt into the program to access the insurance when they have a need for leave. And then really important, to keep in mind coverage for those who work in historically underprotected job sectors, including agricultural, seasonal, domestic workers, and covering part-time employees who are disproportionately lacking access to paid leave, and also are disproportionately women, BIPOC folks, and those with caregiving responsibilities. So a really important need. In terms of number of weeks, best practice ideally is, at least 12 weeks. That's backed up by a lot of public health research. and by a lot of medical associations. So providing that baseline is what we see states striving for, certainly as a starting place. And some states allow combining family and medical leave above that amount. So for example, if you're welcoming a new baby in the same year and happen to have, say, a parent who has a cancer diagnosis, being able to take leave for multiple purposes, some states allow you to combine above 12 weeks. We also have seen more states move towards providing additional leave for pregnancy and childbirth complications. And we're even seeing legislation that's likely this session in Colorado to extend our program for additional leave when a child's in a NICU. So really thinking about duration is important, and there's different ways to approach it and a lot of examples from the state programs. So we can go to the next slide. So yeah, the covered purposes, and Vicky touched on this, the 14 state programs all cover at least a worker's own serious health condition, bonding with a new child, and caring for a seriously ill loved one. Most also allow leave for caregiving related to military duty or deployment, and caregiving responsibilities because of family members' military service. And that tends to be a purpose that's a very small percentage of claims in the states that have it, but can provide really important support to military families. And as Vicky mentioned, we're seeing more states, we currently have 6, providing safe leave for domestic violence, sexual assault, or stalking, depending on the program. And wanted to say too, best practice and the majority of paid leave laws do allow bonding with not just birth or adoption, but also for foster care. And a Better Balance has resources on the case for paid leave for foster care specifically, since that sometimes does become contested in state programs when they're before a legislature. And then some coalitions are considering bereavement leave. Partners in Michigan have been pursuing providing not the full duration for bereavement leave, but at least some days of their proposal when a family member passes away to make arrangements following a death in the family. So something that we're hearing more interest from coalitions on. So family definition, including a definition that's as inclusive as possible is really important. And this is something A Better Balance has been proud to really be one of the leading voices on over the past decade. And we have seen a lot of progress in ensuring that family definitions include a lot of specific relationships like parents, child, spouse, siblings, grandparents, grandchildren, domestic partners. But also, we've seen real movement towards, and now 7 of the state paid family and medical leave law programs allow leave for extended relatives and what's often known as chosen family, but loved ones with a significant personal bond or close association. So we're seeing a lot of progress. We have a lot of resources to support this work that we'd be happy to share. And a lot of coalitions that are starting out with a model family definition and seeing if what's possible legislatively in advancing that. So we can go to the next slide. So again, as Vicky mentioned, the wage replacement rate is a really important component of these programs. And by that meaning, how much of a worker's income do they receive while they're on leave? And you want to make sure that it's high enough to ensure that all workers can afford to take the leave they need. And really especially low income workers, those in low wage positions who need as much of their income as possible to pay their bills. And when you think about it, when someone has a need for paid family and medical leave, there's a new child, a serious illness, that's often when you need your wages as much as possible. So being sure to, and this is something that A Better Balance and Vicky and other partners can help talk through, but wanting it to be set as high as possible. And we've seen states move towards making it more generous, in large part because the first programs really saw that it was a barrier to use for lower wage workers if the wage replacement level wasn't high enough. And so we've seen increases in some of the existing programs. And we've also seen 10 states now include what's known sometimes as progressive wage replacement or graduated wage replacement. But essentially, it's where lower income workers receive a higher percentage of their incomes during leave. So that's something that we have more information on. And I'll flag a lot of our resources that go deeper on this at the end of walking through, but something that we can talk through as well. And then a benefits cap. You want to set the maximum on benefits that a worker can take when they're on leave, also in a way that makes it affordable. And importantly, and this is something that we've learned where it's not the case, you really want to ensure, if possible, that the cap on benefits adjusts annually, that it might be set to adjust based on inflation or move along with the state's changes in the average weekly wage to account for the fact that, how far a dollar goes certainly changes, as we all know, and we want the benefits to keep up with that. So it can go to the next slide. So yeah, just a few more final kind of best practices. Eligibility, and we have, again, models on this, but you want to set access and the eligibility standards to make sure that as many workers as possible are eligible. And a really important point of these programs is that they tend to, the majority, as you can see on the slide, 9 states base eligibility on minimum earnings. There are some states it's not something that would be a best starting place, although there could be reasons based on what information your state already collects for other programs. But generally setting it based on minimum earnings as opposed to a certain amount of time working is the best practice. And the reason is that next bullet around portability. So essentially, we want to allow workers, for example, to be able to access a paid family and medical leave program by combining multiple sources of income is one aspect of this. People who have multiple jobs should be able to access paid family and medical leave based on their earnings across multiple forms of employment. But we also want to ensure that both with eligibility and how benefits are structured, that workers are able to keep their benefits as they move from job to job. As Vicky talked about, some of how these programs are financed, where there's, for example, shared contributions from employers and employees. If an employee has been paying into a program, they really should be able to access the benefit even if they've changed jobs. And similarly, you'll see that it's a best practice in a number of states do allow coverage of those who are recently unemployed. So if somebody has been paying into a program like paid family and medical leave, they qualify. If they lose their job because of, let's say, layoffs, they should be able to access paid family and medical leave, ideally, to get the benefits they've contributed towards the cost of. And this is also important because of some restrictions around your ability in that circumstance to get unemployment insurance if you're not able to seek employment because of a paid family and medical leave need. So again, I know a lot of this is in the weeds. It's a lot of text. I'll point everybody towards different resources that, along with having the slides, can provide more information on these points. And then wanted to wrap up this section with just highlighting employment protections are really critical. Ensuring that workers have the right to return to work following leave and that they won't, face retaliation, be punished, fired, demoted is essential. And there's a lot of research saying that's essential to people actually taking the leave, to benefiting from it, to really ensure that they have the protections that they need and can return to work. And then, for a similar reason, ensuring continuation of healthcare coverage while somebody is on leave is, of course, a really important element of these programs as well. And then enforcement. You want to have strong, robust enforcement to ensure that if there are violations, workers are able to get the remedies they deserve and address any retaliation or violations, and that the agencies are equipped to enforce the law as well as implementing it in general. So we can go to the next slide. And did just want to touch before we turn to questions that you all have, that there are different examples of ways to build progress to paid leave. And some examples include, which I know a number of you are working on in your states, and we've seen a lot of progress of covering the public sector, having a state government be a model employer in guaranteeing paid family leave for their own employees or access to short-term disability. We're seeing traction around educator leave. And I should mention, I said it in passing, A Better Balance has a Southern office with staff on the ground in a number of Southern states. And, a lot of these strategies we are seeing through our Southern office, and those of you in Southern states seeing some more momentum around. Did want to mention actuarial studies. We've seen a number of states that maybe haven't been able to get a full paid family and medical leave program yet, don't have that political path, but have been able to commission or get state funding to run an actuarial study to really provide information that will support, a multi-year campaign by showing that this is an affordable, sustainable, solvent program, and that it will work well is something that's been really helpful. And, the possibility to, and this, of course, could cut both ways. So, the idea of task forces, but I think it's important that they be robust and high quality. And something that I served on, Colorado had a task force before we pivoted to a ballot initiative in 2020. And I got to see firsthand some of the pros and cons. But if you have a task force and can, staff it, in a way that is balanced and has worker voices and advocates and folks who have expertise, it can be a way to move the ball forward and to get good recommendations. And we have seen that in a number of states. So go to the next slide. And just to follow up, a lot of states, again, I think we're up to 36. It might be one or two higher than that since I last counted, but seeing a lot of states that have now paid family or parental leave for state government employees, and including many red states, some growing number of Southern states. And we're also seeing states expanding upon what they already do have. And that's important because women, BIPOC workers are disproportionately represented in the public sector workforce, provides important benefits to a large number of workers. And it, sets the state up to be a model employer to show that this is working well. We've also seen a large number of cities, an increasing number, enacting paid family leave for their own employees as well. We'll go to the next slide. And just some examples of where we're seeing public educator leave policies here, including some Southern states, including with recurring appropriations to be able to fund this for, state public sector educators. So just wanted to lift up that that's a strategy that I know some of you are working on now or expanding upon what already exists for educators, and something that, we're seeing gain more traction. Go to the next slide. And then, yeah, to just follow up on actuarial studies and task forces, we do have examples of where task forces have been really helpful. I've had really strong recommendations, in Colorado, as I mentioned, and also in Maine. It played an important role in paving the way for a strong program. Very strong results of a Louisiana task force that our Southern office and Louisiana partners worked really closely on, that is, helpful for long-term building in Louisiana for this work. And we saw really strong results of a New Mexico task force where partners led by Southwest Women's Law Center are working as we speak on a New Mexico bill that I believe just passed its first committee in this session. So, the task force there really did help and set it up. Wanted to flag on the actuarial study front, Michigan's an example of a recent actuarial study that got very strong results. And, happy to talk through more when, if you have specific questions, but some of the pros and cons and considerations. And we do have model legislation for commissioning actuarial studies as well. You can go to the next slide. Yeah, and then questions. I will pull some resources and send them over, drop them in the chat, but we have a model paid family and medical leave bill. that's been used by most of the states as a basis. We have a best practices document that'll go over a lot of what I covered. Best practices and a map of state employee paid leave. And we'll also drop in the chat a tool that a lot of folks widely use, but we have an interactive comparison chart of state programs that you can kind of compare and contrast what states already do on a range of topics and create your own comparison chart. So I will drop some of that in the chat.
Thank you so much, Jared. We really appreciate your presentation. So we're moving to questions. We do have one question in the chat so far, and it's either for Jerry or Vicky. Is there a list of states with family caregiving leave for state employees, teachers, any done by EO?
Yeah, it's a great question. I will drop in the chat a map that we have of all as of 2024. So there may be a couple editions that are newer. I'd have to double check. But so this is a map of the states that do have it, and you can click on each state to see details about when and a link to the law. And it does say, Beth, what the method of enactment for each state was. And it does vary state by state whether legally this can be done by executive order or whether it has to be done by legislation. But in states that allow it through executive order, it has been done. So very recently, Louisiana, as one of the final initiatives of Governor Bell Edwards in office was to do paid family leave for state employees through executive order. I think we've seen that in other states like Missouri, but the link that I had addresses, it does tend to be more parental leave than family care. And I think one reason for that is that so many states do allow for state employees, particularly those that have access to paid family leave or parental leave benefits, have some existing family care provisions, whether it's through accumulated sick leave or others. But it is something that there has been some interest. And I will say the Arizona governor also did by executive order that then was a follow-up with administrative rules, not only parental leave as a pilot, but also reformed some of the sick leave rules to allow better family care. So it is possible.
Wonderful. We have another question. Are there any toolkits available to educate employers and the public on paid family medical leave? Either one? Vicky?
I'll chime in. I mean, there are definitely a lot of resources. Yeah, I think Voices for Healthy Kids was putting together a toolkit. There have been toolkits over time. And there are a lot of resources from Main Street Alliance and some from Small Business Majority and others that might need some updates, but that are meant to look at arguments and tools that are particularly compelling for employers and especially small employers.
Yep, and I'm going to drop in the chat kind of our landing page that, again, you can find that interactive comparison tool, a lot of fact sheets, the model legislation that I addressed, that can be a resource as well.
And wonderful. And Voices for Healthy Kids dropped their paid family medical leave toolkit link in the chat for more information. We have another question. Do you have recommendations of organizations that have conducted actuarial studies for various states?
Yeah, well, if helpful to know, the firm Milliman, which is a actuarial firm, has done a number of recent states. So they are folks that are very familiar with how these programs work. They have a model that they can customize now pretty quickly. So they are one, actuary that is increasingly supported states and coalitions in this work. But there are others, and I will drop in the chat. It's not a public-facing document, but it should be a link that works for everyone, where we've accumulated some of the actuarial studies that exist, who has commissioned them. And you'll see Milliman again is one of the top. and it is worth, for example, in Colorado, there was another actuarial firm that the state already used for workers' compensation, that, is an example of a state may have its own actuarial firms that they already use. So that's one thing to consider. And there are sometimes research institutions that have helped as well. So that's another avenue that you'll see in the document I dropped in the chat.
Wonderful. As always, you may raise your hand too to ask a question. We have another question. Do you have suggested next steps for advocates in Tennessee to move forward what Governor Lee did with the $15 million appropriation and paid leave for state employees and educators? What would be the next steps for them to take?
Yeah, definitely. So, a Better Balance's Southern office is based in Tennessee. So we have, I think we're up to 4 staff members in Tennessee who are helping to lead the coalition on the ground. So definitely, can follow up with me. I know my email is in the slides too, and happy to connect anybody on Tennessee specifically with what is, it could be its own own webinar on the various strategies and multi-year planning. But happy if anybody would like to connect on Tennessee to put you in touch with our office there and other partners in Tennessee.
And Vicki, you wanted to add?
Yeah, I just wanted to chime in. In general, we now have a number of places that have put paid parental leave, or in some cases, paid family leave policies in place for state employees. But we haven't really seen studies of these policies or had stories collected about the impact, or where there's a friendly administration or agency involved, tried to get a cost analysis. There was a small bit from a city in Ohio a while ago. But yeah, I think there's work to do for advocates on the ground. Also, just digging into where it's safe to do so and where it would be helpful to do so, looking at the impact of some of these state worker policies, to dispel some of the concerns, like when Minnesota was having their floor debate about their really good comprehensive policy, there was this opposition lawmaker who just kept talking about how the one public employee that he relied on in his community was going to be gone, and how could she possibly be gone, and like what would that mean for like the ability of this town to pay its bills. And so I think there's just a lot of misconceptions about what it means when a worker takes paid leave, or when employees take paid leave, and having some data that's local from states and cities that have implemented public sector worker policies to show retention and positive retention impacts, or human needs impacts, or childcare impacts, or health impacts could be really impactful. Sorry, I'm using the word a lot, but to show the effects in the value of the policy, dispel some of the concerns that might be raised, and argue for a broader policy that applies to private sector workers as well.
I will drop in the chat. We just received a report from the state of Indiana. There was an evaluation done of their state paid family medical leave. It was conducted by the Indiana Coalition Against Domestic Violence. I will drop that in the chat for this group as well. As always, feel free to sign up or to join the National Collaborative for Infants and Toddlers. We do offer no-cost policy change and campaign consultation. We are here to support advocacy campaigns in a variety of ways: decision maker advocacy, grassroots advocacy, media advocacy, research and data, and even helping to think about, how you could fundraise for campaigns. So feel free to click the link for the National Collaborative of Infants and Toddlers org. And we have a TA portal where we offer this to all not-for-profits free of charge. We really want to thank you for attending today, and certainly thank our experts, Vicki and Jared, for their time, their knowledge. We certainly are thankful for them for providing the technical assistance to states and coalitions that are pursuing paid family and medical leave. The survey is up on the screen. Feel free to take it. And we will see you for our next iteration of paid family medical leave We will have another training in February as we continue to build this national movement. There are people counting on us, and so we have a lot of work to do. Thank you so much for your time and attention this afternoon. Have a great day.